Thank you for your welcome.
So yes, I'm. Thank you. I've done a lot of tobacco control work, and particularly in smoking cessation. Although I retired last year, I'm still very involved in the field and very connected with my old team and many teams around the UK about stopping smoking. And I really enjoy these sort of talks where we can spread the word. Now, we went e-cig friendly in 2014. I lay awake one night thinking, what can we call this thing where we talk about vaping in a positive way? Because this was very new. I and many others like me were very concerned about the use of e-cigarettes until we started listening to our service users, the ones who'd already tried. They'd seen them advertised, they'd bought one, and they were coming back to us saying, this worked for me like nothing else I've ever used. Now, bear in mind, a lot of our service users they're very poor, they may have poor mental health, they have poor health education, and they've probably tried many, many times before to stop smoking. They've almost given up giving up. And suddenly, there was this revolutionary device that helped them actually do it. So they were coming back to us saying, just after a few days, I realized I didn't want to smoke anymore. So without any research behind us, without any policy, without much planning really, we thought we must do something about this. So we bought a small supply of vapes to start giving out to people. And the team didn't really know anything about how to talk to people about it. We didn't know about strengths, about flavours, about risks. So we had vape shop owners come in to talk to the team to extend our knowledge, and everybody got a lot more enthusiastic about it when they saw from real people the difference that it made. We would give it alongside NRT, and that really helped as well. And it was gathering the success stories that helped us. And we realised that the people who were using an e-cigarette were up to 20% more likely to stop than those that were doing it with nicotine replacement therapy. So just a little bit of background about the services. Every local authority in England did have in those days, some have closed down since then, but that's another story, would have a stop smoking service that would see people for up to 12 weeks. On a weekly basis, they would test their carbon monoxide rates, they would give them behavioural support and medication to stop smoking. And so that's the context. And we would give these free EC starter kits out. We'd say to people, it's not a medication, you don't have to have it, but we just happen to have some samples. Would you like some? And inevitably they would say yes. The interesting thing was that sometimes the partner of the person who actually wanted to stop smoking would be there as well, and they'd be, very kind of, well, I don't want to stop smoking, I'm not ready to stop smoking. But often when they came back the next week, they'd tried their husband or wife's vape and said, I'm going to give it a go as well. And now, it's not just my service, Leicester, that does this. Many other services around the country are also doing this as well. Sadly, not all. There is no consistency. So don't think that England is a fantastic oasis of vape-friendly services. Some services are still very anti, and that is because of the politicians who control that particular local authority. If they have a particular down on vaping, they're not going to support the service talking to people about vaping, which I think is very sad. But we saw consistent success. So of the number of quits that we had, so the bottom number is the number of quits overall, and then the higher number is the ones that tried vaping. And you can see that year on year, when you think that the average quit rate is about 48, 50%, we get much higher success rates when you add an e-cigarette to the quitting journey. Because people like them. People who put a patch on or use gum, they tolerate it. It gives them hiccups or it makes their skin sore. It's not a pleasant experience, and they do it because they really want to stop smoking. But the vapers really enjoy the experience generally, and I think that is one of the problems for the anti-vapers. That, you know, the people who can't tolerate it, they don't expect to see something that is going to work to help people stop smoking be enjoyable. And there's, again, as other speakers have said, there's a moral issue there. We can't have people enjoying themselves, can we? So, over the years, more and more organisations in the UK have added their voice to the notion that this is a much better thing than smoking. So we now enjoy the results of studies by Public Health England, Royal College of Physicians, many others. We had a big government select committee looking at this, looking at the evidence from right across the board and coming back with good recommendations for widening the scope of putting vaping in the public arena and doing something about it. Pregnancy, as we said this morning, we're very tolerant of pregnant women vaping if they were smoking otherwise. And we have to keep, explaining to midwives and others that we're not trying to get non-smokers to use a vape. Of course we're not. But if somebody was going to smoke anyway, better that they vape instead. A small fraction of the risk, and I think that point's been made in several other speaks. So we still have problems with people accepting the notion of vaping as a legitimate way of stopping smoking. And the reason I'm focusing here on healthcare professionals is that in our experience in the service, it's healthcare professionals who kind of get in the way of the positive message. They are very trusted by the smoking patients, clearly. So when the doctor says, you shouldn't do that, it's very bad for you, they are probably going to believe them over us. And this is the problem. So I'm going to just deal with some of the ways we've dealt with the myths, the way we talk to both healthcare professionals and their patients. We don't know about the possible health harms. But, again, the people who want to switch were already smoking, and we've heard comprehensively that there's a huge difference between the risk of smoking and the risk of vaping. No product of combustion, it's the tar and the carbon monoxide. The popcorn lung stories. We've had some new fears raised from all the scares in America. But popcorn lung, I think, is the absolute top number one fear. And I think it's because of the imagery. People kind of imagine that it's something to do with their lungs being full of popcorn. In fact, I think it was the Deputy US Surgeon General that actually said it's because your lungs turn to popcorn. Well, really. But I'm afraid this still persists. So we're dealing with this with patients and with healthcare professionals every day of the advisors' working lives. And of course, we also see GPs, general practitioners in primary care, tell patients, I think you've got popcorn lung. Given that it's something that's only diagnosable on biopsy, that's a bit of a leap of imagination. The addictiveness of nicotine is a real issue. People imagine that if it's the nicotine in a patch, that's good nicotine. If it's the nicotine in a vape, that's bad nicotine. It's the same thing. Smokers are obviously very tolerant of nicotine because they're using a lot of it through combustion, but the same nicotine is used, whether it's medicinal or recreational, it's the same nicotine. And again, we've covered the fact that in France, 80% of people think it's the most harmful chemical. The other thing is that, in fact, I believe that smokers can see a way out. That they want to stop smoking, and if something works, and we know now that in the UK, vaping is both the most popular and the most effective way of stopping smoking. So, I really, really hope that as the years go by, more and more people are open-minded about this. But what is going to get in the way of this is the idea of recreational nicotine. So Sometimes people say it's okay as a stop smoking aid, but they've got to stop as soon as possible. And I would argue that it's much better to encourage people to keep on going, because in our stop smoking service and many others, you see people quit in a few months and then relapse again as soon as they hit a problem with life. You know, they lose their job, they have a fight with their partner, something happens, or they just go to a wedding and start smoking because somebody else gives them a cigarette. So continuing to vape is a really good relapse preventer. And again, we hear this from our service users. They say, I nearly went back to smoking, but I had my vape in my pocket and I had a drawer on that instead. And, you know, they know that this has actually stopped them from relapsing to smoking. Flavours are really important as well. And, you know, clearly the issue in the States with flavours is going to push people back to smoking. But you know, the sweet flavours, the cherry, the fruit flavours, very, very important for adult smokers. You know, just like we all enjoyed our dessert out there in you know, lunchtime, you know, the mango, the strawberry, all those nice flavours, they are just as popular in terms of a vape. Tobacco flavours are left behind very quickly when people transition from smoking to vaping. I'm not going to say much about this. You know, clearly there's a lot of surveillance about Gateway, about, you know, are young people starting to take this up as a habit? They are not. And I believe, from talking to our service users again, that the nicotine in a vape is not addictive in the way it is as a cigarette. When people start smoking, they might start with 1 or 2 and they go up and up, so that before you know it, they're smoking a pack a day. When people switch to vaping, they will tend to come down in strength. Without any prompting, without any effort, they might start on 18 milligrams and within a few months they go down to 12, then 6. Now, they may stay around that level forever. They may go down to 3 or 0, they may stop altogether. That is their choice. That is not for us to say. It's not our business how quickly they come off their vape. It's got to be in their own terms. More claims, you know, that we don't know enough. I'm very often challenged on this, well, we don't know anything about them. I read something like 50 studies a week from a listserv that I'm on, where people are doing research on vaping. There is a lot of research out there. And we know again from clinical experience that those that switch do very well. Their health starts to bounce back very quickly. We've got a clinic in a respiratory ward at one of our hospitals in Leicester, and we see people with severe COPD who've smoked all their lives. When they've changed to vaping, they need less medication, they have more energy, they're less breathless on exertion, and you know, just like somebody who stopped smoking with a patch or with Champix, they do very well. And yeah, again, listen to the consumers, listen to the patients. When they say, this changed my life, believe them. This thing about, you know, not liking to see people vaping. I hear this a lot. You know, people don't like seeing the clouds. They don't like to see, you know, a giant device that somebody's sucking on. Again, none of your business. You know, if you see somebody vaping, celebrate the fact that they haven't got a cigarette in their mouth. I think that's a win. Smoke kills, clean nicotine doesn't. And so these are the take-home messages. You know, time to switch. They're not cigarettes. They shouldn't be treated as such. So in public places, if people can vape instead of you know, having to go outside for a cigarette, they're much more likely to give it a chance, you know, to at least try it. So say on a hospital site, you know, instead of saying no smoking, no vaping, if they could vape, they might think of buying one just while they're visiting somebody, just while they're waiting for their outpatient appointment, just when their kid is in emergency department. To go outside and have a vape will bring a value that may change their life. It may change them from being a lifelong smoker to a non-smoker. Again, we have to tell healthcare professionals all the time that people who've switched completely are ex-smokers. They are no longer smoking. And there's often a sort of argument, well, they're still using nicotine, so they must be still smokers. They are not. They are ex-smokers. And don't push them to come off vaping. So the message, which you probably can't see in that very small text there, is that all smokers should give vaping a try. All people who vape and smoke should try and get off the smoking completely and transition to pure vaping. Thank you.
Thank you very much, Louise.